Good morning, everyone, and welcome to Munson Healthcare's virtual press conference for COVID-19. I'm Diane Mihalik. I am Munson Healthcare's Chief Marketing and Communications Officer, and I'll be your host today. Today is Tuesday, June 22nd. As a reminder, in addition to these press conferences, you can stay connected with Munson Healthcare by signing up for our e-newsletter, following us on social media, or visiting munsonhealthcare.org. Next slide, please. We have a full agenda today of panelists. I'm happy to welcome Dr. Christine Nefsey back. She's the Chief Medical Officer for Munson Healthcare. Also joining us again today will be Bonnie Kruska, the Vice President and Chief Nursing Officer of Ambulatory Services for Munson Healthcare. Bonnie will be giving us an overview of new monoclonal antibody therapy treatment for COVID-19 patients and how patients can self-refer into that therapy. Also joining us again will be Wendy Hershenberger, the Health Officer for Grand Traverse County Health Department, Lisa Peacock, the Health Officer for the Benzie-Leelanau District Health Department and Health Department of Northwest Michigan, and Dr. Jennifer Morse, the Medical Director of District Health Department number 10. We will have a Q&A session at the end of today's panelist presentations, so please submit your questions either directly via this Zoom or via Facebook. And now I'd like to welcome Dr. Christine Nefsey, Chief Medical Officer for Munson Healthcare. Welcome, Dr. Nefsey.
Thank you, Diane. Well, we're just going to head right into the good news we have for our region. You can see here our cumulative data, and then just so you know where we are currently, we look at the 2-week rolling average for our percent positivity rate, and we have been below 2% for just under a week now. We are currently at 1.7% positivity rate, which is really good news for us. Next slide. You can see here our hospitalizations. Those have really remained fairly steady for the month of June. We saw a slight dip today, but we continue to have some admissions for COVID-19, much fewer than what we had at the surge, obviously, but we do continue to see some people hospitalized. Next slide. There you can just see kind of our daily cases and the decrease we've had, and then kind of that steady state we have seen for the month of June. Next slide. I am happy to share we have given over 85,000 doses of vaccine in coordination with our mass vaccination clinics, our primary care physicians regionally, as well as our local health departments. And just to stress, vaccination is really the key to us getting through this pandemic. I'd like to see that number go up even higher. Next slide. Here you can see the state data for initiation. So this is people who have received at least one dose of vaccine. We are at a 55.8% for the state of Michigan. Next slide, and then you'll see where we are regionally. Kudos to Leelanau County for being the highest in the state. We are at a 59.6% rate according to our MICR data. It's actually a little higher if you bring in Department of Defense, VA, and then some of our residents that got vaccinated in other states. Next slide. I did want to touch base a little bit on probably some of what you've been seeing in the news about variants of concern. So the CDC defines variants of concern as those variants that could impact the efficacy of our diagnostic tests, our treatments, or our vaccines. So basically, if those variants show a decreased reactivity to some of the therapies that we use, if they aren't neutralized by naturally occurring antibodies, either through previous infection or vaccination. So if the vaccines that we have, as an example, don't protect against a variant, there's increased risk of transmissibility of the virus or increased disease severity. All of those things would contribute to the CDC calling a variant of concern. Next slide. So we are hearing a lot about this Delta variant, and just to be clear, rather than name some of these variants for where we first noted cases, they are actually attributing them to Alpha, Beta, Delta, that kind of thing. So the Delta variant, which is the B1617, currently is about 10% of new cases in the United States. Over the past few months, it's grown to be actually 90% of new cases in the United Kingdom. This is the variant that has 2 mutations on the spike proteins. And what we know, the alpha variant, which is also previously known as the UK variant, is about 50% more transmissible than the original strain that we saw, which we call the wild type. This Delta variant is about 40 to 60% more transmissible than the alpha variant, so highly contagious. We are still getting in preliminary data from other countries and states, but we do think that compared to the alpha variant, that the Delta is more likely to cause hospitalization. The good news is that while the vaccine efficacy is slightly reduced, it's still very good. So you'll recall that our vaccines typically had above 90% efficacy against this virus. The Delta variant has a reduction of about 1 to 6%, depending on the vaccine. So does decrease it slightly, but still from a vaccine perspective, a very, very good efficacy rate for the vaccines. We continue to follow the prevalence of this variant along with the state, and we'll continue to update you as we see more cases. Next slide. Again, we know people have questions about these vaccines and maybe even the variants and some of the things you're hearing in the news. Your primary care knows you better than anyone from a healthcare perspective. So please, if you have questions, go to your primary care doctor and ask them. If you can't, if you don't have a primary care doctor or you just don't have the opportunity to ask, we also have our Ask a Nurse line that is open and available to answer any questions you may have. Next slide. Next slide.
Thanks, Dr. Nefsi. We appreciate that update. And as you just mentioned, we know that vaccines are effective and they are the first line of defense against COVID-19. Excited to introduce our next speaker, Bonnie Kruska, who's the Vice President and Chief Nursing Officer of Ambulatory Services for Munson Healthcare. And Bonnie's going to be sharing with us another treatment option that is available for COVID-19 positive patients now through Munson Healthcare. Welcome, Bonnie.
Thank you, Diane, for having me today. So I'm able to share a recent change to Munson Healthcare's monoclonal antibody therapy program. For viewers who aren't familiar with this therapy, it's a one-time outpatient infusion for patients with mild or moderate COVID-19 symptoms who may be at high risk for progressing to severe disease. Some conditions that may put an individual at risk are obesity, chronic kidney disease, diabetes, immunocompromising conditions, cardiovascular disease, hypertension, just to name a few. And this treatment may help patients recover quicker and avoid hospitalizations. So if your viewers have questions about COVID-19 symptoms, diagnosis, treatment, I recommend, like Dr. Nefsi said, reaching out to their primary care provider, or they can contact the Ask a Nurse hotline at 231-935-0951. Next slide, please. So how does monoclonal antibody therapy work? It works by mimicking the immune system, and the therapy targets different parts of the virus and it prevents it from attaching to cells within the body. This treatment is indicated for non-hospitalized adults and children age 12 or greater who weigh about 40 kilograms, which is about 88 pounds. They have to have been diagnosed with COVID-19 and able to schedule within 10 days of onset of symptoms. And that's especially important for the efficacy of the medication. Monoclonal antibody therapy is now available at 4 Munson Healthcare sites: Traverse City, Kalakaska, Grayling, Cadillac, and most recently, we've added a 4th option, home health treatment. It may be available depending on nursing availability. Next slide, Diane. And so what's new about the monoclonal antibody treatment program? We've been giving the treatment for almost 2 months now, but we've recently added a referral option. It went into effect last week, so patients no longer need a provider referral to receive treatment. Patients can now self-refer to the program if they are positive for COVID-19, and they simply call the Ask a Nurse hotline. Again, that number 935-0951. This really does remove the barrier that some individuals have of not having a primary care provider and not being able to access treatment. So it's a great new option. This by no means guarantees treatment. If a person self-refers, they can call the Ask a Nurse hotline, and the nurse practitioner will determine whether or not the patient meets criteria. And if they do meet criteria, the nurse practitioner will order the medication, and the nurse will facilitate treatment, schedule the appointment, and do all of the necessary follow-up. So again, if anybody has any questions, they can call the Ask a Nurse hotline. It's imperative that they do it as soon as they develop symptoms, because there is that 10-day time frame that they need to get treated. And to date, our program has treated 66 patients within our service area. So very excited to report that today, Diane.
Thanks, Bonnie. That's a really exciting update for Munson Healthcare and for patients. And once again, if you do test positive for COVID-19, this is an option that you may have. So call the Ask a Nurse hotline, and they will help you determine whether or not you qualify. And it's great that you no longer have to go through your primary care provider to have this. So thanks for that update, Bonnie. We appreciate it. And I just ask that we'll have you back during the Q&A session in a few minutes after the other panelists' presentations. Thanks.
Great.
Next slide, please. Now I'd like to move on to our health department updates. And joining us again today is Wendy Hershenberger, who is the health officer with the Grand Traverse County Health Department. Welcome back, Wendy, and we're excited to hear any new updates in the Grand Traverse region.
Yeah, thank you and good morning. So we do have a few new things today that I can talk about. We are continuing to see low numbers for Grand Traverse County. We're averaging 1 or less cases a day right now and have been for a couple weeks. And our percent positivity is about 1.5%. So Dr. Nefsey talked about our regional numbers, and we're slightly lower than that. So that's great news for Grand Traverse County. We are continuing our efforts to vaccinate, and as Dr. Nefsey said, vaccination is really the key to keeping numbers low and completely getting out of this pandemic eventually. So we are still offering vaccination clinics. We are introducing something called a return window for those who choose to have a 2-dose vaccine. For us, that's the Pfizer vaccine. And what this return window does is it offers people flexibility for when they can come in and get that second dose. We are doing almost entirely just walk-in. We have great availability. So whatever is convenient for people based on our clinic schedule is the time that works for them will also work for us. So the best way to do that is you will receive a slip that indicates you need to come back for a second dose, between certain dates. And then if you go to our schedule, which is either a QR code or our website, you can see when we're offering vaccination clinics. In addition, we also are resuming testing for COVID-19 as we have had some partners who are no longer testing because they're continuing to do vaccination. We are bringing some testing back as well. We're offering it 2 days a week right now on Monday and Wednesdays. So we started back yesterday. It's at the main campus of the health department, which is on the Franier Road. There is no cost, and it is a drive up, and it's in the parking lot in the rear of our building. So it's protected as far as, there's not going to be a lot of people watching or anything like that. So there'll be signs, and it's very easy to get through. Next slide, please. So this is our schedule for this week. Again, we're doing walk-in vaccinations. Today it's from 11 a.m. to 6:30 p.m. Tomorrow, same time, 11 a.m. to 6:30. We're trying to offer a couple evening clinics to try and get some of the teens who might need a parent present. And then on Thursday and Friday, we are from 9 a.m. to 4 p.m. and that's at our Cherryland Mall clinic site. Next slide, please. So also in preparation for Cherry Festival, we will be offering vaccinations at the National Cherry Festival. There are multiple days we'll be offering them. Tuesday, July 6th, Wednesday, July 7th, both of those are from 11 to 3 p.m. Thursday, July 8th from 2 to 6 p.m. Friday, July 9th from 2 to 6 p.m. and Saturday, July 10th from 11 to 3 p.m. Those are the times as of right now. There's possibility that they could change slightly, but this is the times as of right now that we're planning for. We will be offering the Johnson & Johnson vaccine at the National Cherry Festival. And I also want to say we encourage any residents who plan to attend or if they plan to volunteer to get vaccinated now to protect themselves if they attend the festival. Next slide, please. And this slide just shows our vaccination progress. We're doing very well for Grand Traverse County. We're a little over 2/3 of our population has had an initial dose, and we're at over 63% for completion. Again, that's usually about a 3-week delay if it's a 2-dose. And then you can see our coverage rate by age groups. So we're again doing very well for that 50 and over group, as well as the 30 to 39-year-olds and 40 to 49-year-olds we're starting to approach, getting closer to the 70%. Need a little more help in the 20 to 29-year-old range, and then we're still focusing throughout the summer on the 12 to 19-year-olds to get them vaccinated before school. I think that's all I have today. Thank you.
Thank you, Wendy, and thank you for all the hard work that you and your team continues to do to continue to help get vaccinations throughout the community. Wendy, we'll have you back for the Q&A session in just a moment, but next it is my pleasure to welcome back Lisa Peacock, who's the health officer for the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. Welcome back, Lisa.
Thanks, Diane. Happy to be here. Good morning, everyone. So we at the Benzie-Leelanau Health Department and the Health Department of Northwest Michigan continue to see the same sort of decreases that everyone has talked about so far. Cases continue to decline and pandemic risk indicators continue to decline, which is great news. And our vaccination rates continue to increase each week. In the Northwest District, we're over 60% in the 16 and over population who have initiated their vaccination series. And in the Benzie-Leelanau District, we're over 70%. So, those rates have certainly shifted a little bit. The demand has decreased somewhat, but we just continue to keep adjusting our strategies to meet the community demand. So the focus of the distribution plan really in both health department jurisdictions is really focused on reducing any barriers to people who still wish to get vaccinated from getting there. And then another focus is really just encouraging people to protect those around them, even if they don't feel like they are at risk. Someone next to them may be at risk, and someone that they spend a lot of time with may be at risk. And so we really are encouraging the public to continue to get out there and get vaccinated. So at all of our clinics, we are accepting walk-ins, or an appointment can be made online, or you can simply call 211 for assistance with making an appointment. There is a choice of vaccine at every clinic that we offer. We typically have J&J and Pfizer and often Moderna. So people can choose the vaccine that they like. We're holding standing clinics in each county every week. The focus of the Benzie-Leelanau District Health Department clinics now is on two main standing clinics. We have kind of saturated the interest in pop-ups and strike teams out in the community. And so as the demand for that shifts down, we're focusing on being in Suttons Bay every Tuesday from 10 to 12 and being in Benzonia at the Crystal Cafe every Wednesday from 4 to 6. So trying to offer a variety of hours. The Health Department of Northwest District continues to do 6 or 7 strike team pop-up community clinics across our 4 counties every week. We have been at many festivals just about every Saturday. So we are continuing to get out there. We are really focusing on the 12 and over 12 to 19-year-old population. We want parents to know that they can get their kids vaccinated now to be ready for the start of school and the start of sports. We know that this is a key to not having cases in that population in the fall and not having outbreaks and quarantines that are very disruptive for the activities that kids are participating in. So we want everyone to remember that we all have a responsibility to protect those who may still be at risk. There are some people who cannot get vaccinated, and there are some people who just simply aren't able to achieve a robust enough immune response. And even though they're vaccinated, they may still be at risk. And we have a whole group of young children who are not yet vaccinated because they're not eligible yet. So even though broad orders have been lifted, we still recommend mitigation measures, especially for those who have not been vaccinated. So continuing to wear a mask when you're indoors with other people, continuing to keep distance from others is really important for yourself and especially for those around you. So with that, I think that's all I have today, and I'm happy to answer questions later too.
Thank you very much, Lisa. And again, thank you for everything that you and your teams continue to do. We really appreciate it.
Thank you.
Next, it's my pleasure to welcome back Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10. Welcome back, Dr. Morse.
Thanks. All right. Well, just like everyone else, our cases have continued to drop. Things are slowing down, but they don't have much more to go down, but still we are seeing some cases, and our percent positivity is still low. Our vaccinations are slowing down quite a bit, but we do continue to keep vaccinating. We are going to numerous different locations, different fairs, festivals, food pickup centers, churches, restaurants, stores, and you can see a list of those at dht10.org/events. Also on our website, just dht10.org. If you're interested in hosting one of our pop-up events, there's information there on how to set that up. And we'd be happy to go wherever you feel vaccinations would be well received, or anyone would be interested in having vaccines come to them. We continue to take vaccination or vaccinate people that want vaccines or walk-ins even on Tuesdays and Fridays at all of our county offices. Through the end of June, at all of our vaccination locations, whether it's a pop-up or in office, we have all 3 vaccines. So anyone 12 and up can get vaccinated at any one of our locations. After the end of June, so starting in July, we're just going to integrate COVID vaccinations into our normal vaccine clinics. So you can set up a vaccine appointment just like you would any other vaccine appointment with us or any other health department service. So you can get more information on our website as listed there. And again, if you want to keep current with all of our other information, you can subscribe to our public health alerts. But things keep rolling. And again, we're happy to work with anyone who would like us to come to their locations to vaccinate. And I think that's about all I have for updates today.
Thanks, Dr. Morse, and thank you and your teams for everything you continue to do to get vaccinations into arms. Now, I'd like to welcome back all of our panelists for our Q&A session. As a reminder, if you are a reporter on the Zoom, you can submit your question directly through the Q&A feature. And if you are watching us live on Facebook, you can submit your question there and it will reach me. We'll get to as many questions as we can today. So thank you, everyone. And I do just want to remind everyone as well that Wendy Hershenberger from Grand Traverse County Health Department does not have video capabilities. So we'll just continue to hear her voice today. So the first question we have is from a reporter, and it is directed towards all of the local health department officials. So I'll begin by asking Wendy to address this one. And the question states, today's the date the state is lifting all of its broad pandemic restrictions, including indoor mask wearing and capacity caps, but we're still well below the 70% vaccination goal. And as Dr. Nefsi mentioned, there's a more dangerous variant that's growing more prevalent. What do you want us, the public, to do? This seems like a confusing time. How should we make sense of the moves to relax restrictions, even as vaccination slows and dangerous variants increase? Wendy, what are your thoughts on that?
I think it's an excellent question, and I agree. I think it's even confusing for all of us as individuals. I would say that, you know, the pandemic restrictions that were in place are broad. They're for protecting the entire population and public health. But as we move into this next phase, I, those are still good ideas. It's still good if you're going to be in a space with a lot of people that you don't know their vaccination status. If you feel better wearing a mask, wear a mask, protect yourself. And I think people individually need to assess their own individual risk level as well and make that determination what they're comfortable with. So I think moving forward, we're going to see a mixture of a lot of people not wearing masks. We're still going to continue to see people wearing masks, and they might be fully vaccinated, but they might be immunocompromised, or they might not be vaccinated. So we're going to start to see a mix, and we will see how hopefully our numbers continue to stay low throughout the summer. I would also encourage people to do as much, activities outdoors as possible while the weather's nice.
Thanks, Wendy. Lisa, do you have any other additional comments you'd like to add?
Yeah, I agree with everything that Wendy said, but I would just add that, this just because the restrictions have been lifted doesn't mean that there aren't still public health recommendations for protecting yourself and those around you. And so, if you have not yet been able to become fully vaccinated, just remember that there could be people around you that you don't realize are at risk. And so we do encourage everyone that it has not yet become fully vaccinated to wear their mask indoors, especially in crowded places where there may be people at risk that they don't realize. So, I think it's important to remember that this is a good shift. It's great that we are moving away from broad restrictions. I think we've been living like this for a long time, and it will be a little uncomfortable as we make our way out of that, but public health recommendations are still important.
Thanks, Lisa. Anything additional that you'd like to add, Dr. Morse?
Yep, I was just going to parrot what Lisa had said, basically that there are still the same public health recommendations. The rules were just there to make sure that people follow those recommendations. And MDHHS just put a new date basically on their face mask recommendations. They didn't make any changes to them. So basically, if you're unmasked, if you're unvaccinated, you should still be masking, especially in crowded environments. And in other high-risk settings like congregate care settings or homeless shelters, things like that, there's still some masking recommendations. So those have not changed. It's just that having rules to force you to do it have gone away. So hopefully we still use good sense and good judgment and help protect ourselves. So again, I think we'll still see people wearing masks so they can protect themselves.
Thank you, Dr. Morse. The next question is for Dr. Nefsi. Could you please explain what the current policies around masking are for Munson Healthcare facilities, whether it is in a hospital setting or in Bonnie's world, which is in the ambulatory setting, such as clinics and doctors' offices?
Yeah, thank you, Diane. I mean, as Dr. Morse just said, there are still guidelines and rules for other settings that are considered high risk, and healthcare facilities are one of those. So we still are following the CDC guidance and the MIOSHA rules and have universal masking in all of our patient-facing settings, whether it's an outpatient or an inpatient Munson Healthcare facility. So masking is still required. We're still going to ask you to mask. And, that is really for the protection of our patients. Certainly we have very many high-risk people that are coming to the hospital. And it's for our own staff who are around a lot of high-risk people. So we would just ask, as we continue to move to a more open community setting with masking and all of that, that you understand that our hospitals and clinical spaces are places of healing. And those people that are there asking you to mask are really doing it for everybody's protection. So this is when it really starts to come down to our personal responsibility and doing the right thing. And the right thing is, if you are not vaccinated, you should be masked. And anytime you come into a healthcare setting, you should wear a mask regardless of your vaccination status.
Thanks, Dr. Nefsi. Next question is for Bonnie. Bonnie, what can patients expect when they come to a clinic or an outpatient setting? Are we still restricting waiting rooms? Do people possibly have to sit in their cars still? We just heard Dr. Nefsi explain that everyone in a clinical setting will be continued to, asked to be masked. Any other changes that you're seeing?
Yes, so we certainly are in a different place than at the outset of the pandemic. At the outset of the pandemic, we were asking individuals to stay in their cars, especially if they had symptoms that were consistent with COVID-19. And now what we're doing is we're taking a slightly different approach. We're still putting measures in place to protect one another, patients and staff, by asking individuals to socially distance from one another within those waiting rooms. But presently, we are not asking individuals to still continue to wait in cars. If they have a complaint they would like to go to, let's say, an urgent care or walk-in clinic, I would recommend that they proceed just as they would have done a year ago. And if they do have, again, cough, symptoms consistent with COVID-19, they may be managed just slightly differently than before. We may have them be put in a room in anticipation of being seen soon, something like that. But definitely you will notice a change, but still we have all of those mitigation strategies in place to keep everyone safe. And as Dr. Nefsi mentioned, we still ask everyone to mask up within those clinical areas.
Great, thank you, Bonnie. Next question is for Dr. Nefsi. Bonnie mentioned the monoclonal antibody therapy that's now more widely available throughout Munson Healthcare. Are there any other treatments for COVID-19 at this time?
I mean, we certainly have the treatments we've been using on the inpatient side, which really kind of depends on what your symptoms are. So outside of what we've been doing for the past couple of months, there's nothing super new on the horizon. I think the vaccine is really that preventive measure that we're the most excited about. If we can prevent people from ever getting sick and coming into our clinics and hospitals, that would be the best. The monoclonal antibody is a great one for people who are at high risk and have mild disease. But, as far as great new, miraculous discoveries for the treatment of COVID-19, we aren't there yet.
Thanks, Dr. Nefsi. Next question is for Bonnie regarding the monoclonal antibody therapy. Can you just give an overview of what a patient can expect if they do qualify for the treatment and they do are able to get the treatment at one of our locations? What can they expect? How long does it take?
That's a really great question. So the individual will be scheduled for the one-time infusion at one of the 4 sites or at home. The infusion itself only takes about 20 to 30 minutes, but you can anticipate being there for about 3 hours because you need to check in. At the time of check-in, that's when the pharmacy compounds the medication, and we wait and we do vital signs and do a kind of a pre-screening with patient. And then we infuse the patient, and then there's an hour time period in which we monitor the patient after the infusion. And so again, it takes about a total of 3 hours. At day 1 after treatment and at day 10 after treatment, a nurse will call the patient to see how they're doing and how they're feeling. We're getting really good anecdotal stories of feeling better, especially turning the corner at around day 4. But again, anecdotal stories from patients who have received the treatment and feel as though it worked for them.
Great, thank you all so much. Appreciate all the answers. Those are actually the only questions we received today. So if you do have additional questions, please feel free to submit them and we can update our Q&A section on our munsonhealthcare.org website. But I will conclude today's Q&A session right now. I'd like to thank Dr. Nefsi, Bonnie Kruska, Dr. Morse, Lisa Peacock, and Wendy Hershenberger for joining us. As always, the additional community resources that are listed on this page are available to you. I encourage you to call these numbers or look up these websites if you have specific questions about where to receive vaccinations or where treatment is available, or just general questions about COVID-19 in our area. Next slide, please. And again, as a final reminder, please sign up for our munsonhealthcare.org e-newsletter. Follow us on social media or visit munsonhealthcare.org for the latest updates. Thanks again for joining us today, and we will keep you updated as to the next press conference that we schedule. It may be 2 weeks from now, but depending on the latest changes that are coming, we may also have one next week. So we'll keep you informed, and looking forward to having you join us again. Thanks, everyone.
Thanks, Diane.
Thank you, Diane.